Heart disease is the #1 cause of death around the world, taking 1 in 3 lives, more than cancer and most other conditions combined. The scariest part? It doesn't always come with obvious warning signs. Instead, it can strike suddenly, often with symptoms so subtle they go unnoticed. A heart attack, stroke, or cardiac arrest can happen in seconds, leaving little time to react. But the good news? Many of these conditions are preventable if the signs are caught early. Today, we're breaking down 11 unexpected signs of heart trouble that many people miss. Recognizing these early could make a life-saving difference. Stay tuned, and if you experience any of these symptoms, always consult a healthcare professional. Sudden fainting spells or episodes of dizziness can alarmingly signal critical problems with the heart, such as arrhythmias or arterial blockages that disrupt the normal blood flow to the brain. These cardiovascular irregularities can cause a sudden decrease in cerebral perfusion, leading to temporary loss of consciousness or a dizzy spell. Such symptoms are particularly concerning if they occur during physical activity or are accompanied by chest pain or palpitations, as they might indicate underlying severe heart disease. Immediate medical investigation is essential to determine the cause and to initiate appropriate treatment, as addressing these symptoms early can prevent potential life-threatening complications and improve long-term cardiac health. Bleeding gums are often dismissed as minor nuisances, perhaps caused by brushing too vigorously. Yet they could be heralding a more serious condition known as periodontal disease, which involves inflammation and infection of the gums. This inflammation can allow bacteria to enter the bloodstream, where they contribute to the formation of plaque in the arteries, increasing the risk of cardiovascular diseases. Regular dental checkups, proper brushing and flossing, and possibly using an antibacterial mouthwash can significantly mitigate these risks. Moreover, stress reduction is crucial as stress can exacerbate gum inflammation, further linking dental health to overall cardiovascular wellness. Prioritizing oral care is not just about preventing tooth decay. It's about safeguarding your heart, too. Loud snoring may sound harmless, but can be a symptom of sleep apnea, a condition where breathing stops intermittently during sleep, causing significant oxygen deprivation and cardiovascular strain. This disruption in normal breathing patterns forces the heart to work harder, increasing blood pressure and the risk of developing heart disease. Using a CPAP, continuous positive airway pressure machine at night can keep airways open, ensuring steady breathing and reducing heart strain. Alongside CPAP use, lifestyle adjustments such as losing weight, quitting smoking, and avoiding alcohol before bedtime can greatly enhance treatment effectiveness. These changes not only improve sleep quality, but also significantly diminish the risk of severe cardiovascular complications associated with untreated sleep apnea. Experiencing sudden, severe weakness can be a critical warning sign of acute heart distress, potentially indicating an impending heart attack. This type of profound fatigue is markedly different from the usual tiredness that comes from lack of sleep or prolonged exertion. It is an intense, crippling weakness that doesn't alleviate with rest. Such a symptom demands urgent medical evaluation, as it often means that the heart is unable to pump blood efficiently, depriving organs and muscles of necessary oxygen. If accompanied by other symptoms like chest pain, dizziness, or shortness of breath, immediate emergency care is crucial to address what could be a life-threatening cardiac event. Skin conditions such as psoriasis and eczema are not only uncomfortable due to their itchy and unsightly rashes, they also signify deeper systemic inflammation that might increase the risk of cardiovascular diseases. These chronic dermatological issues are linked to an elevated inflammatory response in the body, which can contribute to the hardening and narrowing of arteries, a process known as atherosclerosis. Managing these skin conditions effectively requires more than just topical treatments. It involves holistic care that includes dietary changes to reduce inflammation, regular medical checkups, and possibly systemic medications. Persistent nausea or indigestion that doesn't have a clear cause may be more than just a stomach issue. It could be a subtle but serious sign of heart trouble, particularly an impending heart attack. Often, these symptoms are mistaken for less severe conditions like acid reflux or a digestive upset, especially in women who may experience these as their primary symptoms of a heart attack rather than the more commonly recognized chest pain. It's critical to consider these symptoms within the broader context of one's overall health, particularly if they occur alongside other heart attack signs such as shortness of breath, sweating, or pain in the chest, back, or jaw. Seeking medical evaluation for persistent gastrointestinal symptoms is essential, as timely diagnosis and intervention can be life-saving. A chronic cough or persistent hoarseness might be more than just an annoyance or a sign of a respiratory issue. It could indicate congestive heart failure, CHF, particularly when accompanied by other symptoms like leg swelling or difficulty breathing. In Swiss francs, the heart's decreased efficiency leads to poor blood circulation and fluid buildup in the lungs, which can manifest as a chronic, dry cough or hoarseness. This fluid accumulation in the lungs makes it difficult for patients to breathe normally and can exacerbate respiratory symptoms, especially when lying down. Recognizing and addressing these symptoms early with medical intervention can manage heart failure more effectively, potentially improving quality of life and reducing the risk of more severe outcomes. When your calves swell or ache, particularly after activities like walking or climbing stairs, it might be tempting to attribute these symptoms to normal wear or aging. However, such discomfort could signify peripheral artery disease, PAD, a condition where arteries narrow due to plaque buildup, seriously compromising blood circulation. PAD not only causes pain and swelling in affected limbs, but also significantly increases the risk of heart disease and strokes. To prevent these severe outcomes, it's crucial to engage in preventative measures such as maintaining an active lifestyle, adopting a heart-healthy diet, and managing cholesterol levels effectively. Early diagnosis and treatment can alleviate symptoms and reduce the risk of heart-related complications. Excessive sweating that appears suddenly and without clear cause is often more than just an issue of overexertion or a warm environment. It could be a critical warning sign from the heart. This symptom, known as diaphoresis, can occur as part of the body's stress response to a struggling heart during a heart attack. It is especially concerning when it happens concurrently with other symptoms such as chest pain, shortness of breath, or dizziness. Such combinations suggest that the heart may not be pumping effectively, prompting an emergency response from the body. Recognizing and responding immediately to this symptom as a potential heart attack indicator is vital, as prompt medical treatment can be life-saving. Intense, sudden, or unexplained anxiety can occasionally be a manifestation of underlying heart disease rather than a purely psychological issue. This type of anxiety may arise from physiological disturbances caused by irregular heart rhythms or other cardiovascular abnormalities that affect the body's stress responses. Such symptoms are often overlooked as solely mental health concerns, but they can indicate significant physical health problems, particularly in the cardiovascular system. A comprehensive cardiovascular evaluation is crucial when anxiety is accompanied by other potential heart-related symptoms, such as palpitations, shortness of breath, or chest discomfort. A noticeable decline in exercise tolerance, such as becoming easily winded during activities that were previously manageable, is a significant indicator of potential cardiovascular issues. This symptom suggests that the heart may not be pumping efficiently, struggling to deliver the necessary oxygen-rich blood during physical exertion. Such a decrease in stamina can be an early sign of heart failure or the onset of other serious cardiovascular conditions. It is essential for individuals experiencing these changes to seek evaluation from a healthcare provider. Early diagnosis and intervention can help manage the underlying causes, improve cardiac function, and potentially prevent the progression to more severe heart conditions. Recognizing these 11 signs can empower you to take proactive steps towards heart health. Incorporate heart-healthy habits, such as eating well, exercising regularly, and quitting smoking. Regular heart checkups can detect potential issues early, significantly improving outcomes. Remember, when it comes to heart health, prevention is always better than cure.